Welcome to Writer's ER, your go-to spot for tackling the tough parts of your dissertation, thesis, or any big project you're working on for your master's or PhD. Today we're diving into a super cool topic: epidemiology and big data, tracking diseases in the digital era. This is all about how the smart use of big piles of data is changing the game and keeping us healthy and safe from diseases. Picture this: you wake up, grab your phone, and you see a news alert about a health department predicting a flu outbreak weeks before anyone has even sneezed. Sounds like something out of a movie, right? Well, it's not. It's happening right now, thanks to big data analytics. This stuff is powerful and is reshaping how we track, predict, and fight diseases all over the globe. Big data is a bit like a giant puzzle. Pieces of information from social media, online searches, health apps, and medical records are all coming together. When we put these pieces together in the right way, we get a clear picture of what's happening with diseases, which ones are spreading, where they might hit next, and who could be most at risk. If you like this chat and want to hear more, hit that like button, share this video with your friends, and subscribe to Writer's ER. Let's talk about how this helps with keeping an eye on diseases. It used to be that we'd find out about an outbreak after a bunch of people got sick. Now, with all this data, we can get ahead of the game. Imagine being able to tell where the flu will hit weeks before it actually does. This means hospitals and clinics can get ready, vaccines can be sent out to the right places, and hopefully fewer people get sick. This isn't just about guessing better when the flu season will start. It's also about figuring out who might get hit the hardest by different diseases and why. By looking at lots of different data, like where people live, how old they are, and what health problems they might already have, doctors and scientists can get a better idea of who needs the most help when an outbreak starts. Of course, this isn't all easy. There's a ton of data to sort through, and we have to be really careful about keeping people's information private and safe. But the good stuff that can come out of this, like saving lives and stopping diseases before they spread too far, is super exciting. For those of you diving into health sciences for your advanced degrees, this is a thrilling time. You're getting into a field where tech and health cross paths in some amazing ways. The stuff you're learning and the projects you're working on could help change how we all stay healthy in the future. So what do you think? How else could big data help keep us healthy or change other parts of healthcare? Drop your thoughts in the comments below. Your support means we can keep bringing you more insights to help you on your academic journey. Let's hit those buttons one more time, like, share, and subscribe, and keep building a community where we all learn and grow together. Thanks for hanging out with us today. We're excited to share even more helpful tips and insights in our next video. Stay tuned, keep pushing forward, and here's to making big strides in your studies and beyond.